Welcome to the full episode of Scalpel Reflections. I'm Dr. Sabita. I'm here with Dr. Samson Jimson. Scalpel, as all of us know as doctors, that's our bread, butter, and passion. But beyond the scalpel, there is a human touch which revolves around it. So, Dr. Jim has been very thoughtful in putting across a sunrise, a reflection, or anything beyond as a surgeon, how they would feel and how they will live through a life which involves around your profession. Here I am with Dr. Jim. Dr. Jim, your videos are on Instagram, and can you tell us more about the precision and the first incision which you would look into when you see a patient or you're going to work on a patient?
Thank you for that kind introduction and welcome to Scalpel and Beyond Scalpel Reflections.
Thank you, Doctor.
It is my privilege to make this happen, Scalpel Reflections. And your first question is straight away on incision. A very incisive question as that. Yes, as surgeons, and you being a periodontist as well, it is about incisions also. And in life, yes, you need to be precise, you need to be incisive, but you have to be very thoughtful in that, because once there is a cut, you can always suture it back, but then the mark stays for life. Like, for example, when we say that when a glass is broken, it can always be repaired, but then the line stays. So there should be a lot of thought behind what you see and how you go about doing things. The preparation that you'll have to do before making the first incision. And coming to this Scalpel Reflections, I think there's quite a lot of thought which has gone into it before first incision that we have made today. Being a teacher for the past 30 years and taught many students, I thought this is much more appropriate to go beyond the student community to a public at large.
So, what made you think about something beyond a scalpel or beyond a life of a surgeon and to show that there is something which can relate to your professional life and your personal life?
Well, the public would have seen an operating room in a movie, yeah, wearing a cap and with the mask, with a surgical gown, and once they are all on, they are all sterile, and you are not supposed to touch anything else other than sterile surgical area. Not many people know that. Likewise, every individual has got his or her own insight into life. What you perceive somebody from the outside is maybe completely different from what they are from within. We cannot live for the society, but at the same time, we cannot forget the society as well. So somebody is point blank in saying what you are doing is right or what you are doing is wrong, but somebody is very diplomatic. But there is no diplomacy when you are making an incision. An incision is an incision. There is no diplomacy in that. Likewise, in life, you have to be incisive. You have to be decisive in making the decision to be incisive, but at the same time, not hurt people. Comparing a surgery to a life is sometimes not very easy, because when you make an incision, it hurts, but then it should hurt to heal. Maybe that takeaway point is it should hurt to heal.
Is it like always the first incision, which I was just talking about? Does it always feel like the first cut you're doing, or over the years do you get beyond it?
That is a very, very important question. Very, very interesting question as well, because an incision, even before you make an incision, now 13 years into the profession, still an incision is an incision. Because it is not about an incision, it is about the soul that you're going to heal.
Very true.
Yes. So that will definitely play in any surgeon's mind before we make an incision, because we cut to heal. We make an incision to heal. It can be a patient who's been suffering with oral cancer. It can be an emergency procedure, a patient who has been wheeled in from a road traffic accident. It can be any kind, or an elective procedure like an orthognathic surgery. It is an intraoral incision or an extraoral incision. The incision is the same. Cut to heal.
So, relating the incision to life, every time we take a decision or we are moving into a new venture, the kind of apprehension or the tension which is involved for every situation in life, the same way an incision also for each patient is going to be different. That's what you're trying to portray,
Yes,
right?
yes.
Exactly, coming into the first incision. So before we go in for an incision or for a surgery, I think scrubbing in is what we've heard about. So what is exactly scrubbing in, and do we really relate it again to life, saying that we need a lot of preparation to manage a situation and then go into the situation? does it actually fit into that?
Exactly. If you fail to plan, then you plan to fail. Likewise, in surgery also, scrubbing in, like now these days you can see everybody wearing a scrub. But then when as surgeons we enter the OT, we consider that as sacred. The responsibility itself is different. We feel empowered. Likewise in life, you plan. If you don't plan, like what I said, if you fail to plan, you plan to fail. So this is all a preparation. So surgery will be rewound again and again and again and again in our mind, because as you know, anatomy differs from individual to individual.
Exactly.
Not the same surgery can be applied for every individual. Dissect your way according to the particular patient's anatomy. Likewise, individual situations are different for each and everybody. What may be right for me may be wrong for you. What may be right for you may be wrong for me. But eventually there is something which is right, which may not be acceptable to you or me, but take the right way. Likewise, surgery is also like that.
Having prepared yourself for a situation like in life, the same way we prepare ourselves to encounter a surgery. But there might be situations where you might feel that you haven't done the right way, or maybe you've gone wrong somewhere. So, how do you mend it, or how do you take it forward from there?
Going wrong, yes. As surgeons, we have plan A, also plan B, and also you should be ready for plan C as well. See, because once you enter a operating theater, you cannot close a wound, come back the next day, reopen, anesthesia, all these things cannot happen. So you should always have plan A, plan B, and I would go an extra yard to say that plan C is also necessary for any eventuality. Likewise, you compare that situation to life. Yes, for example, you can reach Nagercoil via Trichy, via Trivandrum. You can go by train, you can go by road. Yeah. Also, if these options are not available, go by air as well. So all these options should be considered before you venture out into anything. Likewise. So plan A, plan B, for me, it's plan C as well.
That's a very insightful thought. And so I think that gives us a lot of insight towards handling your life situations also, in the way we handle patients. Basically, we need to have a lot of other thoughts of saying that if this doesn't work, then we have to look into something else, rather than saying, no, I have failed or I've gone wrong, and sit in one place.
I've heard people saying that now I have run out of ideas. So you cannot run out of ideas. So you need to keep exploring.
Exactly.
You need to keep exploring, and you should have a very clear mind when you are exploring. If your mind is cluttered, you're not going anywhere. You should have a very clear mind. And the thought process, sometimes me, when I am driving, I get quite a lot of interesting thoughts. Creative thoughts. Everyone is different. That is when I get some thoughts, something of that sort, and then sometimes I fail to remember that by the time I reach the destination. But most of the times, yes, do I remember? And so that is how you can never run out of ideas.